Okay, knee issues. I want to talk about the kneecap in particular today. I could probably do 5 videos on the knee, but we're just going to stick to the kneecap today. So the kneecap is that bone that kind of floats around in there, and then when our knee is relaxed, we're able to like wiggle and jiggle it around. But then when our muscles are really, really tense, we can't wiggle and jiggle it around, and we certainly can't wiggle the kneecap around when we're standing. So what is it about the kneecap? Well, it's not so much the kneecap as it is what's going on with it. That gives me an indication of the patterns of muscle tension through the leg that's causing pain somewhere else in the knee. Because I never have to deal with kneecap pain. We don't really get kneecap pain. What we get is pain behind the kneecap, or along the inside of the knee, or along the outside of the knee. So there's one thing that's very common, and that's when the kneecap gets pulled up and out. Okay, I'm going to show you. So, up here. All right, so you've got your knee, right? So your kneecap gets pulled upward and outward by the thigh muscles, okay? In that situation, it's going to be called Patello femoral syndrome. The femur and the kneecap, the patella, are being squished together too much. Okay, let me show you again. All right, so the kneecap and the femur, the big thigh bone, are being squished together too much, causing the leg to rotate outward. Now, what do you think that's going to do to the foot? Eventually you're going to get foot pain. So if you've had foot pain and your knee has been doing a lot of clicking in the last several months, let me know that when you come in. Also, if that leg is being pulled and twisted to the outside, what do you think that's going to do to your hip? You're going to get a twist in your hip, right? What do you think that's going to do to the low back, the lumbar spine? You're going to get compression in the lumbar spine. There's going to be pulling. The muscles are going to be out of whack. They're going to be out of balance. Some of them are going to be too overly stretched, and some of them are going to feel squished. And so as a result, you're going to get this pattern of flexion all the way from the spine to the foot. I see this a lot. There's a lot of different reasons why we get patterns of flexion between our lumbar spine, our low back, and our foot. There's a ton of them, and I find them all fascinating. I know the difference between them, and I work them in different ways. It's very hard for me to describe verbally because it is very subtle, and it has to do not only with the muscle bone patterns going through the lower body, but it also has to do with the way the nerves are going through as well. So that's where it gets complicated, but I find it fascinating. Another issue that I often see is the inner knee pain. And so when people say it's my inner knee, like on the lower aspect of it, and so you've got your kneecap here, but then you've got your inner knee, and it goes right about there. Okay, so you got your kneecap here, and the pain is right about there, right there. And that's very, very common. The thing about that area is that, yes, I do have to treat that and release the muscle flexion that's causing so much aggravating pain in that region of the knee, but that's not the root cause, usually, of that problem. Sometimes it is, not usually. Usually, it's because of a hamstring problem on the back outer. Okay, so if you're getting an inner knee, it's oftentimes coming from back here. All right, so then I have to then treat both the front of the thigh and the back of the thigh, which is fairly easy to do. It's pretty straightforward. It's just 2 different body regions. And you have to know, because sometimes you'll have a pain in one area, but the source of the pain isn't actually in that area, it's in another area. And so it does take detective work and frankly experience. It's taken me 13 years to learn all this stuff about the human body. It's taken lots of practice. And as a result, I have a lot of fun. I get to work very specifically with nerve muscle groups, with joints, with fascia, and really get some solid, sustainable work done. And then I get to teach you about it. I get to explain what the problem is. I get to use pictures. I get to print that stuff out for you. I get to make you little self-designed YouTube videos that's only for you, that's unlisted, and send that link to you so that you've got your own video. Or I can send you to my website if it's just a common video most people need, and I'll send you there and do one of those. And you're doing your own exercises every day, but it's not arduous. It's not hard slogging work. It's, you know what, this is a reasonable thing for me to do. It keeps it very simple. You're not using rubber bands on, bike tubes on the side of the table, and you're not using all this equipment. You're just doing something simple, whether that's resting in a certain body position while you listen to your favorite music for 10 minutes, or whether that's a series of very specific body movements that I provide to you because of your specific problem, and we go through the entire sequence. In that way, you end up educated about your own body's dysfunctions so that if this problem happens again in the future, you know exactly what to do. And in the meantime, you are doing your own rehabilitation of that muscle area. You are treating yourself in the comfort of your own home for 10 to 20 minutes a day. And then my treatments just become the trampoline. They basically mean that when you come and get a treatment from me, I'm teaching you how to go from, so I get you from here. I do a treatment, we spring you up to this level. So you're at this level of improvement. Okay, so with a typical muscle treatment from anybody, you're pretty much going to go back down within a couple of weeks to about there. Maybe not fully there, but there. And then you got to do another one. You go back down, you do another one. That's why I call it a trampoline. The rehabilitation for injuries or like chronic problems in the muscles, it's very much a trampoline effect. And so my job is not only to treat you, but it's to get you so that once I give you a treatment and you're here, you don't go back down. You go here, I give you what you need, and you just keep going up until the next treatment. And then I get you way up here, and then you just keep going up, up, up. And that's how we do it. Very efficient. And that's why I love doing pain management so much, is because it's a team thing. You and I are working together. I'm teaching you how to do it. As long as you're willing to put in some effort at home, you're going to learn more about your body, but you're going to feel very good about yourself that you are participating in your own recovery process. And wouldn't that be amazing?